It says low network. Oh, there's our network connection. What's up, fam? It's your boy, ZDoggMD. I'm live to the whole group today. I'm in Atlantic City. Look at this dopeness. I don't know what that is because in Vegas we don't have this thing called water, but we're here at the Hard Rock Hotel and Casino with so many doctors. Make some noise. What is this? Yeah, that's right. I was going to say New Jersey doctors and they're all silent. Like, that's not how they were 5 seconds ago. They were like, yeah, let's go. What are we going to do? So I'm here because I'm speaking tomorrow for the New Jersey Doctor Patient Alliance. And it's a group of independent physicians working together with patients to try to solve these problems that seem to be dividing and separating us from our patients. This idea that there are middlemen like insurance companies and others, the bureaucrats, the PBMs, everybody that would want to drive a wedge between us and what our calling is, which is to take care of you, the patient. So we wanted to talk today about something practical because y'all, here, let's sit down here and talk to Dr. Pete. But and we'll kind of go through and we'll take some comments. And in fact, we have a few. Aaron Sanchez, what up, Aaron? Stephanie Stevens says, hi, Z. What up? Thanks for supporting the show. So I have this thing. This is Pete DeNoble.
Hello.
Orthopedic surgeon?
Yes.
What do you specialize? What's your...
I do shoulder to hand, so upper extremity.
So I have this thing, dude.
All right, let's
AC. Okay, check.
Yeah,
that's it.
We need surgery.
Okay, perfect. So let's say, Dr. Pete, that we have our supporters here. They're all logging in. By the way, before we go into that, so here, this is amazing. We're talking about billing today. We're going to talk about how, if you get a crazy surprise medical bill, how can how can we help you advocate? Don't just go write a check for that bill. I've made this mistake, man. So let's tell the story. You see this thing here? That is a nasty scar. Mm-hmm. And I got this because I just moved to Las Vegas. And oh, that's so interesting. There's just like, look at that. See, it's like we couldn't have designed the set better. Someone's actually watching the show. This is so meta. It's Julie. And so what happened was I was hiking in Red Rock up in Las Vegas. You know it well. Have you been up there?
Yeah, about 4 years ago. But I almost dehydrated making it to the rock. You didn't bring no water.
By the way, that is the dopest New Jersey accent I've heard since I was born here.
No, that's Brooklyn.
Is that Brooklyn?
I gotta know Brooklyn over here. I'm from Brooklyn.
Get out of here, man. I was born in Morristown. I don't know anything. And it's been like a decade. No, wait, it's been more than a decade. I left when I was 8. How old am I? 45? I like to round down. So I'm hiking in Red Rock, and I was talking business with some guy. We were talking about building our clinic. I was not in my right headspace. I put my foot in the wrong place, which was a void, and went falling right onto my head. Had an out-of-body experience, the whole 9 yards, blood coming down. And my buddy was with me, and he's a doctor, but he's one of those doctors who... He didn't do residency. He was like, I don't want to practice, so I'm going to be a consultant. So he took his MD and he became a consultant, which, as we know, is a nothing thing. It just goes and talks. And so, yeah, these are all practicing doctors. So they're like, I see them all nodding. And so he's like, he's freaking out. The blood's coming down. I go, give me my phone. I take a picture of it. I go, that's 3 stitches and a tetanus shot. And so I end up going to the local ER because it's after hours. The sun had set. I get my 3 stitches, very nice, it was fine, I had to wait in the hall, whatever, who cares? I know how hard it is to get through the ER. So I was happy that I got stitched up, the ER doc was great. A month later, I got one bill for $4,000. And that was, and it was itemized. So like each stitch was $1,000. The tetanus shot was $500. And again, no transparency, no idea where this came from. And then a month after that, I got another bill from the ER physician group for some exorbitant amount. And nowhere on the bill did it say, don't pay this. Nowhere on the bill did it say, your insurance may cover some of this, or this is negotiable, or, it just said, the doctors are saying and the hospital is saying you owe them this and you could get in trouble if you don't pay. So what did I do? I did a show about how I'd been basically robbed, and I paid the bill. I found out later I didn't need to pay that bill. Like, I could have gone and that's what we're going to talk about today. If I, a physician, got screwed, imagine what's happening to the little old lady who goes into the ER or one of our patients. And so tell me about this, Pete. Like, what do you, because you have this conference here and you're teaching other docs how to handle this so they can talk to their patients better.
Absolutely. So what we're doing, what the Doctor-Patient Alliance does, is advocates not only for independent doctors, but our patients as well. And our patients are getting victimized just as much as we are in this healthcare environment. This healthcare environment is ill. I mean, we have major reform to do, and part of what we're advocating for is patient-oriented reform. As it pertains to this particular subject, surprise bills are a big deal. We see legislation happening here in Jersey. We have now people talking about how to fix it on a national level. But what I'd like to kind of focus on today is when you're the patient and you get that bill in the mail, what do you do about it? Because there's something you can do about it today. And when you're absolutely right, it doesn't say don't pay this and call your doctor and the hospital and the insurance company and start seeing if their stories are lining up. Because guess what? They probably aren't lining up.
Yeah, not at all.
Sometimes those bills just magically disappear. And so if you just pay it, you may just be out of money that you should have just kept. So you have to be your own advocate. What it really should say on your medical bills or even on your EOBs, where it says, literally it says, this is not a bill. It should just say, you're on your own, but be your own best advocate. And that's really what we're trying to tell people.
And EOB, for people who don't know, is explanation of benefits. And this is insurance lingo for, well, here's what's covered, here's what's not covered. And they absolutely do. And they don't say what's applying to your deductible. And a lot of people now have these very high deductibles. It gets very confusing. And in fact, there was at a time, and I don't know if this is still the case, an industry of people who actually exist just to advocate for you and your bills. So in the worst case scenario, you get $1 million bill from the hospital. You may want to retain one of these people to go fight for your bill. I think they take a piece of the savings or something. It depends. It was, in the popular press for a while. But what can we as clinicians, we as, nurses and doctors and, dietitians and pharmacists, what can we tell our patients? Because you know what? This is the dirtiest thing about this. These are middlemen, right? They're insurance companies because that's how our system's built up. I don't want to talk smack about them, but I will say this. They suck. And and they're like, everybody's like, yeah, they suck. They suck. These are all doctors here. We've all been through it. We all are trying to fight for our patients. And so Pete, what the middlemen do is they make it very obfuscated. Even that word, I don't know what it means, but I read it somewhere in an SAT test. It's so confusing that then the patient shifts the blame from who is to blame, which is the middleman, to who?
The doctor.
Us.
These guys.
These guys are going golfing. They're taking my money. I can't believe,
It's the greedy doctor.
It's the greedy
That's
doctor.
the narrative. That's what they want everyone to believe. And, as doctors, we haven't done a good enough job advocating for the solution, which is not that it's the greedy doctor's fault. It's just that we haven't been out there explaining how patients advocate for themselves in these scenarios. And that's really what we're trying to give them tools for.
And you know why? Because we're too busy clicking the damn boxes in Epic to get paid, man.
50 clicks.
50 clicks for an Ambien. But this is, I think this is the bottom line is, if we do empower ourselves, like that's what you're doing. Is that what was the reason you formed the New Jersey Doctor-Patient Alliance? This is a group. I'm speaking for you guys tomorrow. I mean, why?
Well, we've gone on to talk about a lot of different issues, but actually, ironically, the singular issue that we formed around was this exact issue. We were in New Jersey getting blamed for this problem, which was surprise bills.
Yeah.
And we just kept taking it on the chin in the media.
So the media was hitting you guys too. Oh, bill
time.
from doctor, $10,000. Yeah.
And some of it had validity because we didn't know how to help our patients negotiate. And give them the tools about how to appeal things, and we weren't doing a good enough job talking about bills with patients. We just wanted to be doctors.
Yeah.
But we were getting pummeled in the public relations end as being greedy. But in the reality is there's something else more complex going on in the background that we didn't really understand, and now we're starting to understand. Patients certainly don't understand, and now what we're trying to do is what we're learning, we're trying to bring to the patient's awareness.
Yeah. No, and I think we have to take on the moral responsibility of that. So we talk a lot about burnout. I actually call it moral. Simon Talbot, Wendy Dean wrote a stat news piece that went viral. We shared it on our page about moral injury. And that's what happens to us when we see our patients getting absolutely robbed. Right? And I see people nodding here. They're getting robbed. Now, you're an obstetrician, right? Whoops.
Gynecology. OB/GYN.
Oh, gynecology.
Yeah.
See, I don't understand the lady parts at all.
Yeah. Well,
so
really?
I just say OB and I'm wrong. I don't. My wife will tell you, no clue.
That's not good. There's a few books I can give you, though.
Good. I need some books. So in your practice as a gynecologist, Now, patients obviously are going to get bills from your practice. Have you encountered what Pete's saying where you're being blamed for these insurance?
Yeah, our patients, we try to be I speak with my patients very clearly. My office manager is wonderful, Beth, and she explains a lot of things as much as we know. One of the hardest issues I feel is we don't know how much our patients may have to pay because we have no idea what the insurance is going to cover. So I can't tell a patient really, truthfully and honestly, you may have to pay nothing. You may have to pay something. Your insurance may cover none of it. They may cover all of it. I know what I'm billing, but I have no idea how much of what I'm billing out they are allowing. So how do I even know what percentage the co-insurance is? How do I know how much of the deductible they're really responsible for? Do I tell them after I've already treated them? That seems unfair to me. I would want to know ahead of time what I have to pay as a patient.
Ooh, this is such a painful truth that patients don't understand. And so if there's one thing we can do today with everybody here is to teach people we're the victims in this too. Now, again, it sounds terrible because, here we are, somebody here has got a Lexus. I guarantee you, who has the Lexus? They're richer than that. No. The idea that, we make a good living because we sacrificed our 20s and done all this means, poor doctors don't understand what you're getting charged. But the truth is there's no way we can. And what you said, did I introduce you by name yet?
Shaga DeNoble.
That's right. You are married
I
to
am married, yeah.
Pete. So let's see, an orthopod and a rhinocologist, was it? That's a rhino-gynecologist according to Tom Heineberg. You guys are power physician couple, but you still, when the patients come, you feel terrible that you don't know what it's going to cost. It's like going to the mechanic and going, can I get an estimate? And them going, you were going to do what needs to be done.
Then later.
And then whatever it costs, it's going to cost. Yeah. I'm sorry. And that's what we're stuck with. And then we wonder, of course, patients are upset. You would be upset in any other consumer industry.
Right.
So the question is, what do we do about this? What's the answer to price transparency? Do we kick the middlemen out? What's your call? All of the above.
But definitely transparency on the part of the insurance companies, I think, would make things a lot easier for everybody involved, for the patient and for the doctors.
Yeah.
Knowing the insurance companies have to be a lot more transparent than they are now.
Yeah. And, so I want to, let me come back to Pete here. Thank you. I'm not trying not to trip on your nice shoes. He has nice shoes. Orthopedic. I'll show you what I'm wearing. This.
Those are much more comfortable.
Well, I got them at the Nordstrom rack because I won't shop at the real Nordstrom because it's very expensive, and they were like $50. So I'm about bargains, people, and that's what we're trying to teach our patients is if you get this big bill, it's all rack rate. Mm-hmm. What is this rack rate? Do you know what this is? Because I had to learn about this.
Rack rate?
So I call it a rack rate. It's the charge master rate.
Oh, the charge master for the hospitals.
Yeah.
So it's the lockbox inside of which there's a charge that no one can understand, and they actually just recently, I think nationally, were told that they had to publish these rates. Now, if anyone's out there has found out the rates the hospitals are charging, they've made it very hard for you to figure it out. They'll have all the CPT codes with random numbers. You'll have no chance. So even though that was a gesture towards transparency, you don't have a shot.
They recently published some of these, charge master rates. Everybody's laughing because they're like, we know what those look like. It's like, IV tubing, NOS, plexi, non-saline, 10, $60. And you're like, okay, what does that have to do with?
No one's going to do that. No one's going to do the math.
The tumor I had removed. That was just tell me what it cost. So I think what you entirely might be another. So with some type of direct primary care options. Now, it doesn't work for specialists so well, but it works great for primary care. Just saying, insurance isn't involved in this. You're going to know what you pay. It's a monthly fee. And if we transform overall our healthcare payment model where the government can actually subsidize those fees for you, instead of having to worry about Medicare for all, we could say, well, how about the government will pay for your primary care. If you're poor, if you're not, you can handle it on yourself. That primary care will prevent the other disease. But when you have to go see Pete for your AC joint reconstruction or whatever it is that what this thing is?
That's the AC joint. Is it really bothering you? For real?
It used to when I used to have my kid. I used to hold her over my head and do a lot of this.
Yeah.
And I would get that. And
weightlifters have that a lot.
Weightlifters. So I used to do a lot of those kind of things. And then I was like, you know what? I'm married. I'm old. Why the hell am I lifting weights? I'm just going to let it go. And now it feels great. It's because
it's a solution. Stop working out.
Stop working out. It's cushioned by all this
Public
fat.
health.
Exactly. Now I forget exactly what we were talking about. We were talking about charge master, direct primary. Oh, yeah. So then if you need to see Pete, you have catastrophic insurance. That is true insurance. That will cover Pete because Pete is trusted by me as the primary care doc, and I know he's going to do the right thing for the patient. And there's transparency in terms of what the patient pays. But we're not there yet.
No.
So in the absence of that, we have to fight back by saying, okay, we're gonna ask about the bill. We're gonna call. Who do you call? I mean, how do you begin to deal with the bill?
The first thing I would suggest is that you call the doctor's office or the billing company and get their take on what, because oftentimes we don't even know what you're getting as the patient. We don't even know you received a bill. We don't even know you received an EOB and what the numbers on that look like. It says this is on a bill, but we all believe this is going to be a bill in several days. So we want to make sure that or I should say, as a patient, you should let your doctor know. If it's your doctor or the hospital know, you received something, you're questioning it. Don't take what you get in an EOB as the truth, because guess what? That's oftentimes not the truth. And so I think we've gotten used to trusting our institutions, trusting our big corporations. And I think we've also realized more recently that is definitely something we shouldn't do. So this is exactly the same situation. Challenge what you're being told. Call the insurance company and say, what is this? They'll tell you, no, you got to pay it. Doctor's going to have to bill you.
You also have to ask the insurance what they're going to pay.
Yeah,
and that too.
Explanation of your benefits.
Exactly.
So you need to ask the insurance company what they're going to pay. And this is, I think what you're saying is right. Don't just take anything at face value. And it's often people who do that get these like huge bills and they don't realize that. And it's a common misunderstanding. It was really, really common. Now, the only time you should trust big corporations is when it comes to vaccines, okay? I don't want to hear any crap from any of you.
DJ, can I say
Yeah,
something?
you absolutely may.
Yeah,
I'm just going to slide in between y'all.
I want to go into your occasion where you fell, you hurt yourself, you had an emergency.
What's your specialty? What's your name?
I'm a general surgeon. Now, I might have been that guy that was suturing your head closed, but the public's got to understand that most states have laws that protect the patient. Now, whoever comes in to suture that wound closed, that insurance company is supposed to pay that, okay? And when you get these exorbitant bills, like with us, it's called the Doctor-Patient Alliance, not the Doctor Insurance Alliance. You call us up, and if we're part of the whole process, we're going to work with the patient to get what the law says to pay the doctor for the emergencies. And it doesn't matter whether you're in, out of network, out of state, wherever you're at, that insurance company should pay for that problem. And when you get that bill, you call the doctor up, especially with us, and we work with you, and we try to get that money from the insurance company, which in most states, by law, they're supposed to pay.
Oh, hell yeah!
So
I
you
like
better-
that.
You better call up and get your money back.
I want my cash money.
All right?
They better not have 5% of my money, not 30% of my money, 110% of my... Do you hear me?
I'll take 10% of it.
He's my pimp. Okay, so check it out, though. Seriously, because you brought up something that was very important, and that is out of network. When I had this happen, the bill I got from the emergency department group was, quote, an out-of-network fee.
Right,
Now,
right.
here's the thing. When I'm going to the emergency department, am I going to be like, I'm sorry, I can't have you, sir, because you're out of network? They don't tell you.
See, that's why laws were made in the state that you're not going to sit there for 5 hours to try to find a guy that signed a contract with these insurance companies, because a lot of people can't survive on the amount of money that they're paying them, the insurance companies, and they created narrow networks that they can't survive on it. So a lot of people elect to go out of network where if they're going to provide services by the laws of the state, they should pay.
Yeah.
And so it doesn't matter in out of network. You got an emergency. It should be paid by the insurance company,
And just
not you.
I'm with you. Jessica Carana says your 10% is a very cheap pimp, number one. Number two, Carol Harcrow says my ER visit cost $33,000 for 4 hours.
All right.
I mean, I hope they were giving you a gold exoskeleton.
Well, you have to look at that bill and find out who's charging $33,000. I bet you out of that $33,000, $29,000 was the hospital.
Yeah, but who gets the blame?
The doctor.
The doc, and this is the problem. And this is now it's become so adversarial between doctors and hospitals now, except in the states where corporate practice of medicine isn't a thing, and the doctors are just owned by the hospitals.
Well, the most important thing in patient care is the doctors and the nurses. Corporate is getting in the middle of the way of taking care of our patients. So we have to make a stand as doctors across this country and nurses across this country to take back medicine and provide the proper care we want to provide for our patients.
People are like, Z-Dog, why are you in Atlantic City talking? Because of this. Because that's what Health 3.0 is. It's clinician-led grassroots change that takes medicine back for us. But not just for us, it's for us so we can take care of you, the patient. That's what it is about. So, I mean, but okay, speaking of which, you're a general surgeon?
Yes, sir.
Don't violate HIPAA. What's the nastiest thing you've pulled out of a butthole?
Something that looked like this. And it's true.
I
It was a
don't
candlestick
know.
holder.
This is, hey.
And you know how precarious it is getting this out without breaking it.
This
True
guy
story.
knows. He knows his game. Let's read some comments, and then we'll talk to some other folks here. Let's see. Oh, yeah, Zon Mundang. You ever drive 7 hours?
7 hours to get a torn rotator.
Torn rotator cuff to get back
I
in
don't
network.
know what state you're in, but most of the states that you're in would have protected you if you just stood at that first place that you went. That doctor should be able to take care of you, because that's why. 7 hours could mean a life.
And see, Ramnik Mathur says, exactly, Z-Dog, there's a fundamental difference between this industry and others. You don't have the luxury to shop rates when you're having a heart attack. The line of thinking is silly when you're trying to create an effective and pragmatic healthcare system. This is the thing. First of all, there's no price transparency. There's no true open competition, because it's basically a monopolistic oligarchy of a few players that set prices, including Medicare. And then we are then the victims of those. So whatever they decide they're going to pay you for taking that thing out of the rectum, you got to take it. And you don't set prices. It's not competition. The patient has no sense of who's quality and who's not, except for what's on Yelp. And Yelp is total bull crap, right? And so, because it's either people who are really pissed or really happy. There's nobody in between. So we need better, and it needs to be led by us. It can't be led by the insurance companies and the government and the regulators. Look what happened at Vanderbilt. Do you guys hear about this thing at Vanderbilt?
No.
So, okay, let me look here. I want everybody in on this, because this is important for nurses and doctors and everybody who takes care of patients. Let me see. How do I do this? I want it to be dramatic. All right. There's a nurse at Vanderbilt. They had just gone live on Epic. All the medication stuff was effed up. So stuff wasn't coming out of the Pyxis. It was a complete train wreck, right? And so what ends up happening, this was a year ago, she's taking her patient. She's the help all nurse. She has to transport, and this is a known ICU nurse who is beloved by her colleagues, who all of them reached out to me and said she's really a wonderful person, great nurse. Makes this horrible mistake where she's trying to get something out of the Pyxis. The order for Versed, for sedation, for this woman's claustrophobia, wasn't accessible because Epic, who knows, right? Probably a systems problem, right? So what ends up happening? She ends up typing in VE to override, pulls out the drug, thinking it's Versed. It's Vecuronium.
Oh.
So now she's giving a paralytic, gives it to, now this was a horrible mistake. The patient is in the scanner, no monitoring, because it's not a protocol or whatever. They pull her out 30 minutes later. She's already, they need to code her. She's brain dead. They pull support. Now, this happened a year ago. Vanderbilt said nothing. They told her, we're not going to fire you, because in a just culture environment, you go through and go, what were the mistakes? Was there recklessness? Was there substance abuse? Was there malice? No. Maybe it was reckless because she overrode and didn't do the 5 rights of medication administration, whatever. A month later, they bring her in, fire her. So she's, okay, fine. They don't do anything. Medicare then finds out, threatens to take Vanderbilt's funding away. At this point, they make it public. They finally tell the family through the press a year later that it was Vecuronium that was given. All right? The whole time they're like, we're Vanderbilt, we're better than all, we don't need to deal with this stuff. So what ends up happening? This nurse just got arrested for reckless homicide. So what happens? The institutions that are supposed to protect patients and work with us to heal people throw the frontline providers under the bus. And who suffers? Our patients and us. The family said she would have forgiven this nurse if she were alive. And we understand what we want is better safety. So who is responsible for that? Do we trust these hospitals to do the right thing? Do we trust someone with an MBA who's never touched a patient to do the right thing? No, it has to be us. Like the people in this room that are they're taking their Friday night and they're coming here to learn in seminars about how to help and how to stand up and grassroots organize. So that's why I get excited coming to these things. Anyways, I'm going to get off my soapbox for a second. Who wants to talk? Anyone? Everybody's stunned into silence now. They're like, I don't want to be a part of this at all. He's going to get us all fired, except we're all independent docs, right? No?
I'll say something.
Oh, yeah.
I think it's very important. You know, the other thing that...
Introduce yourself and your specialty.
I'm Dr. Cyril Randazzo, neurosurgery.
Ooh, fancy pants.
It's also, you know, the other thing insurance companies obfuscate is your benefits. So they very clearly tell you what you have to pay for that policy, and that it's going to go up every year, and that if you pay 3 days late, they're going to cancel you. And if you're stuck in the ER on that day, you're getting the whole bill, and they're going to say, oh, sorry, you didn't pay your premium. What they don't tell you is what are your real benefits. They tell you you have out-of-network benefits now, but your out-of-network benefits are at less than Medicare rates. So now you're paying for a Cadillac, and you're getting a Yugo. Like, Yugo's all gone.
Yugos are dope, man. I had one of those. $2,000 back in the day.
So be very careful when you're shopping for a plan that you know exactly what you're paying for. If you're going to buy a car, you check out all the amenities, right? But look at that, it's like 50 pages at least right now when you get your plan. And a lot of times your actual benefits, your summary plan benefits are not in there. So they'll tell you you have to pay this premium. You have a $50,000 a year deductible, but they won't tell you what they're actually going to pay for your care. So make sure that you're getting a good product. You're getting the product you're paying for. Everybody's paying, even all of us in this room, we're paying more and more every year for healthcare, for health insurance, and we're getting less because they're obfuscating all of our benefits.
I'm with you 1,000%. By the way, you're a fellow of the American Academy of Neurological Surgeons?
Correct.
So I'm speaking for them in San Diego this year.
Oh, great.
I'm going to tell them about Health 3.0, and they're probably going to cauterize some nerve that will allow me never to speak again. So what, as a neurosurgeon, an independent neurosurgeon, what has been your biggest challenge dealing with our current medical system to take care of patients?
I think the biggest challenge is all the paperwork. It's all the bureaucracy. You know, a lot of us go and we sacrifice for years just to take care of patients. We never learn in medical school, although now I think they're starting to teach maybe one course, right, in medical school about the bureaucracy of healthcare or the practice of medicine. But you don't learn about this. You don't learn about billing. You don't learn about coding. You don't learn about how to send bills, how to collect bills, how to pay your staff, right? A lot of us are small business people. We have to learn how to run a small business when most of us just go to medical school to take care of patients, and that's all we want to do. And every year now, there's more and more barriers to that. There's the hospitals, there's the insurance companies, there's the politicians, you know. Everybody has an agenda in healthcare. Our agenda is to take care of patients, and that's what we want to focus on, and that's why it's the Doctor-Patient Alliance. We want to bring that back so that we can just focus on taking care of patients and making sure that, you know, they're not driven into bankruptcy, because you guys have enough to worry about when you're sick. You don't want to have to worry about what the bill is, and you shouldn't have to do that. But a lot of times you come to see us, we don't know what plan you have, we don't know what we're going to get paid, and so we do it in good faith to take care of patients, but we have staff, you know, we have to pay, we have insurance we have to pay, and we want to improve the transparency so that patients know that when they need the care, they're going to be able to get it.
Yeah. And people don't realize this, that really the small business owner aspect of medicine, you're employing people. I mean, there are nurses here watching that are employed in these small practices. They are the lifeblood in many ways of community economies, as are hospitals. And so any discussion of transforming healthcare has to take into account the economic aspects of that. Who else wants to say something? Aha! We have a very Socratic democracy here. Introduce yourself, your name and your specialty.
I'm Monica Tadros. I have ENT and facial plastic surgery.
Okay, tell me about my nose. What can you do about this? It's hooked and it's big. See? She said the right thing.
It's got great character.
No, that's the catchphrase for I can fix that.
It depends on what you need. Can you breathe?
Maybe.
Okay.
Yeah.
No, I think one of the really important things that I wanted to highlight was that there's some fear associated with choosing your doctors these days. You're so afraid of the bills that you're going to get that part of this alliance, the Doctor-Patient Alliance, is advocacy to understand what your rights are as a patient. What good is it to have out-of-network benefits if you don't even know what that means? And how, you know, you might just, say, look in your plan and try and get care, and you wonder why you're just constantly being prescribed the same thing in a different bottle.
Let me ask a question, and this is a controversial one. Should we just throw it all away and have a single payer plan where we all just build a government?
Absolutely not. I think there's a lot of socialist medicine out there, many countries we can look at, and everybody comes here to get the best care.
So yeah, and I've been very nuanced on this. I don't think you do a single payer until you fix the care model and what we're paying for. Like, because otherwise you're just paying for the same fragmented over treatment and all the other stuff that we're already doing, and you just pay for it poorly. Doctors don't want to do it. There's no more innovation, but there are ways to cover everybody, because universal coverage is what we want. Everybody wants. There's no doctor that's like, I think there should be uninsured that we shouldn't get paid for.
Absolutely not. Look,
Right.
doctors are patients too. We have families with patients. We care for our patients like our own family members. So at the end of the day, we want patients to really seize control over healthcare with us. We are your allies. We went to medical school and we devoted our lives to taking care of patients and to taking care of you. And our stressors are that's being taken from us.
Yeah.
I mean, do you remember back in the day when your doctor knew everything about you? That you weren't just another number coming in. Now the processes, the systems are taking that away from us. And we have to join together. That's the purpose of this.
I mean, I'd walk into my doctor's office and he'd say, ZDogg, how's the meth lab cooking? And I'd say, you know what, it's going. There's the blue stuff. It's pretty pure, but I could do better. You know what? You keep at it, ZDoggMD. No, but that's what it is. It's the moral injury of not being able to do what we went into medicine to do. And this is not just doctors. This is any healthcare professional and every patient who's experienced the commodification that comes with what we call Health 2.0, this matrix of medicine as assembly line.
Yes.
That's a great point. Thank you. Anybody else want to make a fool of themselves? Here we go. It's nice to be able to talk to smarter doctors than me. Usually it's just me going, well, I don't know. I do stuff.
I'm Lawrence Stankovitz. I'm a pediatric orthopedic surgeon on the Jersey Shore. And
Have you worked on the situation? Because he's a man-child.
he's a little old for me.
I got it. Yeah.
But he's in my catchment area. So.
Right. But his mental age is younger.
Yeah. What I want to touch on is what I think are the most important aspects of approaching how to handle a surprise bill, or a bill that makes you panic when you get it in the mail, or an EOB that it makes you panic. And to me, what I've seen as the most successful patients in battling their bills is the attitude they take towards communicating with their physician. The people that call up kicking and screaming, saying you're a bunch of F this and whatever and a bunch of crooks, they rarely get anywhere.
Yeah.
And can I speak to your manager approach? It just doesn't work in this business.
That's a great tip, actually. I want to put a punctuation mark on that, because remember, these are human beings on the other side. It's not a machine that you're talking to.
No, and for all of us that are sort of small practices, my billing manager is my mother-in-law. I mean, you're getting a human being on the other line. And the most important thing you can do is establish a line of communication, lots of emails back and forth. Keep us. We will help you with the language to talk with your insurance company. And when you get that language and you communicate with them, communicate with us the feedback that you get, and we will help coach you along the way. And that way we partner to help you work with your insurance company, and those are by far the most successful patients getting their bills paid.
That's a really, really good advice. Now, thank you. I'm hearing, do you guys have to go to a seminar, or you guys got to run down?
5 minutes.
5 minutes? All right, we got a 5-minute warning. Let's take some comments and see if our docs here can answer. By the way, people really are appreciating your guys' time and effort. I see the comments here. They're really happy to get your input and the varied input that we're getting from different specialties. Michelle Klein, can you emphasize, that's something, hang on here, where are we? See, loving this live broadcast, where are we? Loving this group of docs. Stop blowing smoke up our butts and ask us questions. Meth lab cooking, I know I have a meth lab, Danny. Let's see. Well, there's some positive here. Kim Miko says, I go to an amazing primary care group in Philadelphia that is exactly what healthcare should be, and it's amazing. You know, this is a good point. Part of the reason I do these shows from the road is I want to highlight bright spots where Health 3.0 is emerging. And this is one of them, because people care. These are doctors who deeply care. They're not just sitting here saying, I'm burned out, I need to meditate, someone get me a wellness coach, I need a massage, where are my essential oils? You're a pain doc, yeah?
Yes, hi, how are you?
Well, introduce yourself.
I'm Ruby Kim, I'm a pain physician.
Ooh, Ooh, PM&R based.
PM&R
yeah.
based, yes.
What?
Woohoo.
So if I come to you and I say the only thing that helps me starts with a D, it's da da da. What do you say?
I'm sorry.
Oh.
No.
Do you do pain contracts?
I do pain contracts.
Yeah,
yes, yes. I've actually been able to get a lot of my patients off pain medications.
Please tell me how you do that.
It's a lot of work. Actually, it takes so much more work to get somebody off of medications than it is to write a prescription.
And do you get paid for that?
No.
Mm.
No, especially not the pain patients.
Oh, so could we say this, that at the heart of this big dysfunction we're talking about is another crisis, which is an opioid crisis,
Correct.
or an anti-vaccine crisis, where we no longer have the time to develop relationships. Like we use, 80% of the world's opioids?
Correct.
Do we have 80% of the world's pain?
No, we do
No.
not, no.
So it means that something's failed in our system, and I think it's this. And by the way, you're a fan of the show, so I want to
am.
thank you for watching.
Thank you for
Thank
coming.
you.
I'm
Oh,
so
it's so
glad you
exciting.
made it.
She came up to me when I first walked in the room. She's like, oh, she starts talking to me like she's known me.
I know you.
And I'm like, I don't think I know you. And if I pretend I know you, then I'll be accused of racism because my wife is Chinese. You're
Oh,
Korean,
I'm
yeah?
Korean, yes,
yeah,
I am.
see? And if you mess things up, if you get your Asian radar wrong, whoosh, in the eye. I've had it with my wife before. Any other parting words before everybody has to run down?
No, I think this has been great. We really have a great group of doctors here, and all the people who are here today are here advocating for you, advocating for our patients, because we're on the same boat. Like Monica said, we're all patients too. We've all experienced this. We've experienced the bills. We've experienced what it's like to go to in-network, out-of-network, try and decipher it. There's no transparency. We want the truth. We want to just know, what do I get? And nobody will tell us. The health insurance companies are not giving us the information, so then how can we pass that information on to you?
Until we all stand up together and make them. And we will.
Yes,
we
that's
will.
right.
Because you know what? In the end, we do have the power. We just don't know it, right? We're all conditioned to feel powerless. And the groups like this where we get together, and it's not the AMA and it's not these bigger groups, it's these smaller grassroots groups that are not in the pocket of any industry, but independent clinicians.
Correct.
That is what it's about. All right, Z-Pack. This has been a lot of fun.
Yeah.
Pete, any parting words?
No, I'm glad. Thank you for watching. Hopefully this was enlightening and helps you in your endeavors as patients.
I'm into it. I'm into. Oh, the website. The website. What's the website?
It's our website's www.drpatientalliance.org.
I'll put it in the link,
Yep.
and people can check it out. And Atlantic City in the house. One last round of applause for these guys. There's no one can hear us clapping, but we'll clap. And we out. Peace.